So hello everyone. Today we are going to discuss a case of traumatic lip injury. The patient came to us few days back with this lip injury that crosses the 1 million border on the right side. And before starting to discuss this case, I think we should all be knowing about a bit of anatomy of the lip, the muscles, the nerve supply and the blood supply of the lip. So first of all, I'm going to talk about lips muscle attachment, blood and nerve supply in a brief. But so the muscle which is attached, the muscle attachment is the orbicularis oris, which is lined in a circular pattern. The blood supply and the nerve supply, which plays an important role while managing these type of cases. The blood supply to the lip, it comes via the superior and the inferior labial arteries, the branch of the facial artery actually. And the nerve supply is by the trigeminal nerve. The upper and lower lip is supplied by the trigeminal nerve. So coming to the major part of this case is we should know the layers of the lip. Like we know the layers of the scalp, you know that. So the layers of the lip also we should be knowing. There are 3 layers of the lip that comprises of the skin or the outer mucosal layer, then the orbicularis oris muscle layer, and then comes the internal layer, that is the oral mucosa. So we have 3 layers of the lip. So we should be knowing about all of these things to proceed with the management part. So patient came to the dental clinic in this condition with a deep cut on the right side of the upper lip, starting from the inner mucosa or the oral mucosa and extending to the orbicularis oris muscle and to the outer layer of the lip that was crossing the mammalian border of the upper lip on the right side. So the cut was deep and we did manage it quite well, and I'm going to talk about how we managed and how we should manage these type of cases in our dental clinic. So first of all, you have to clean, you have to wipe the area, and if it's a male patient, and you try to shave that mustache from that region. So as you can see, now we shaved that particular area so that we get the vision, a better vision, so that we can manage this case after giving a local anesthetic and IV injection for the pain relief. We try to stop bleeding. If you have a hemostatic agent in your clinic, you can put that also in that, or you can soak that gauze piece in that and you can put that on patient's affected area so that the bleeding gets stopped. You have to achieve hemostasis, but you cannot wait in that case. When these type of cases comes to your clinic, the first line of treatment is to manage the bleeding part, and if there is a deep cut or deep tissue cut or deep lacerations, you have to manage that and you have to suture it for that time, and then you can refer the patient to the medical center, or if you have done a good job, then let the patient come to you the next day. And so the x-ray that I'm going to share with you is, you can see this is the central incisor, lateral and the canine that has come in the x-ray or in the radiograph itself, and we can see there is a there's a radiolucent line you can see at the apex of the root of this affected tooth, that is 1-1 of this right central incisor. And we can see here even the lateral incisor also, there is widening of PDA ligament space, and the affected tooth, that is central incisor, it surely has this widening of PDL space and the loss of lamina dura. That's due to the traumatic injury to the tooth. And coming to this radiolucent line that is at the apex of the central incisor, how can you say that this is the fracture line? This is a radiolucent line for sure, we can see that is running across the tooth. But can you tell me in the comment section how we should be so sure that this is the fracture line itself? So we have given the sutures to the patient, that is the interrupted sutures we gave for this patient. The sutures that we used was non-absorbable, non-braided. It was the silk sutures 4.0 number, and the patient was quite happy after the sutures, and the pain also got relieved after a few minutes, as we have given this IV injection for pain relief to the patient. So this is the video that we made. The patient came on 5th day, and you can see that it has started to heal up. You can see this scab formation. Scab is nothing but the platelets that clump together at the site of the wound, and they form a big clot, and they achieve hemostasis. And when it gets dried up and it gets hard, it gets crusty, then a scab forms. So you can see a scab formation here in patients inner side of the lip, or the patient's lip mucosa, or the oral mucosa. The scab should typically it falls off in a couple of weeks, but you have to be very careful. You have to clean that area so that it doesn't get the secondary infection in that area. So I have asked this question in my Instagram page also, and they did quite well, the students and my fellow colleagues also, they did quite well. And so this is the patient's intraoral picture. You can see the ecchymosis on the gingival part of central, lateral and canine region. It will also get healed up within 2 weeks of time. We have given the medication to patient, even the topical medication have been given to the patient. So the patient will come after 3 days now for the follow-up, and I'll have few more pictures clicked after that, and we have to remove the sutures after 7 to 8 days, starting from the very first day. You can see this is the healing of the lip sutures after 5 days of treatment, and it is doing quite well. Now I'm going to give you some tips when these patients come to your clinic. The first and the foremost and the important tip that I'm going to give you is to see for sensory motor deficit. When this patient comes to your clinic, before giving LA, you have to check that sensory motor deficit. You have to palpate on the area around the infected region, and you have to ask the patient whether the patient can feel the sensation, the touch sensation or not. Then the minor lacerations that of the lip, it should be left like this, that can be healed with secondary intention. And forcing the edges of the lacerated lip together for closure, it can cause unnecessary scarring of the region. And you have to be very careful when these type of lip lacerations comes that crosses the mammalian border. That should be reapproximated, and ideally there should be less than 1 mm of error to avoid unnecessary scarring and cleared formation after few weeks. So that's it for today. I hope you liked this video, and please subscribe and like. This patient, when it comes for the follow-up, I'll take the other photos and the post-treatment pictures and suture removal pictures of this patient. Thank you. Please subscribe. Thank you.